Hi, and welcome to the Misericordia Health Centre, Manitoba's Eye Care Centre of Excellence. I'm Josh Manuso, and today we will be learning all about vitrectomy surgery. What is a vitrectomy? It's a common medical procedure where the gel inside your eye is removed to provide better access to the retina for repairs. The gel is called vitreous. That's where the name vitrectomy comes from. After the repairs are made, saline fills the eye, but sometimes a gas bubble or silicone oil may be injected to help hold the retina in position. A vitrectomy treats a number of conditions such as a detached retina, a macular pucker, a macular hole, or complications from diabetic retinopathy. More information on all of these conditions can be found on Misericordia's website. Let's discuss how you prepare for your vitrectomy surgery before you come to Misericordia. It's very important not to eat any food, smoke, chew gum or tobacco, or drink alcohol the night before surgery. If you have food after midnight, your surgery will be cancelled. You can have clear fluids up to 2 hours before you arrive at Misericordia Health Centre. Clear fluids include water, apple juice, cranberry juice, tea and coffee without milk, cream, powdered creamer, sugar, or sweetener. You can also have clear soup broth without noodles, vegetables, or meat. Do not have sports or carbonated drinks. On the morning of your surgery, most regularly scheduled medications should be taken with a small amount of water. There are 2 exceptions. Please do not take any diuretic or water pills. And if you are diabetic, please do not take any diabetes pills. If you are on insulin, check with your surgeon or family doctor about whether you should take any insulin the day of your surgery. Here's what to bring to Misericordia Health Centre: your Manitoba Health Card or other insurance coverage information, all your medications in their original containers, and this includes pills, eye drops, patches, insulin, inhalers, and herbal remedies. Please leave your valuables at home. It's important not to wear any makeup, nail polish, or perfume. If you are under 18 years of age, a parent or legal guardian must accompany you to your surgical appointment. Please also arrange to have a responsible adult stay with you at home for 24 hours after your surgery. You will not be able to drive after your surgery, so please arrange for an adult driver to collect you. You are able to take a taxi or a bus as long as you have a companion with you. If you are from out of town, you will need to arrange for a place to stay overnight in Winnipeg. Your post-op check will take place the next morning at the Misericordia or at your surgeon's office. All pre-op instructions can also be listened to on Misericordia's General Surgery Information line by calling 204-788-8400. If you become sick or you are unable to keep your appointment leading up to your surgery date, please call your surgeon's office. If you are sick the day of your surgery, please call Misericordia Health Centre's patient registration at 204-788-8303. Now you're all ready for your vitrectomy surgery.
Hello, my name's Frank Stockel. I'm going to take you through what to expect on the day of your vitrectomy surgery. Misericordia Health Centre's parkade is located at 25 Sherbrooke Street in Winnipeg. The second level of the parkade, level 2B, is reserved for patient parking. Please proceed to patient registration on the first floor, where you will need to show your Manitoba Health Card or other insurance coverage information. Here's Richard, one of my patients. He's here for vitrectomy surgery today. Once registered, you will be directed to Elevators A, where you will go to the 3rd floor Ophthalmology Assessment Unit. Turn left out of the elevator and check in at the nursing desk. The Ophthalmology Assessment Unit staff will show you where to change into your surgical gown and help you get ready for your procedure. A nurse will ask you a few questions to verify your medical information. You will also be asked what surgery you are having and to which eye. You will be asked these questions several times as you get closer to the operating room. These multiple checks are done intentionally to ensure the quality and safety of your procedure. You'll have your pulse, blood pressure, and oxygen saturation levels checked. The nurse will clean your outer eye with an iodine solution and put eye drops in your eye. You will also have an IV, so we can give you fluids and medications for your anesthetic. The anesthetic nurse or the anesthetist will meet you to review your medical information. You will now be taken by a healthcare aide to the operating room on the 4th floor. You will be sedated but awake during your surgery. We can't allow you to sleep during your surgery, as this might lead to sudden head movements. Just before the vitrectomy operation, you will meet with the eye surgeon and the operating team, which may include a resident or a fellow working with your surgeon. Your medical information and operating details will be reconfirmed as a final check. A typical vitrectomy surgery takes 45 minutes. Your heart rate, blood pressure, and oxygen levels will be carefully monitored throughout your surgery. Here's how vitrectomy surgery is performed for a retinal detachment. A small instrument is placed into the eye to remove the vitreous gel. Once the vitreous is removed, your surgeon will inject a gas or silicone oil bubble in the eye to push the retina back against the wall of the eye. The tears and weak areas of the retina are then sealed with either a freezing probe or laser treatment. Here's how vitrectomy is performed for macular pucker. Your ophthalmologist makes tiny incisions in the sclera, or the white of the eye. Using microsurgery instruments, your eye surgeon removes the wrinkled tissue on the macula as well as the vitreous gel that may be pulling on the macula. Here's how vitrectomy is performed for diabetic retinopathy. Your ophthalmologist will use an operating microscope and small surgical instruments to remove the vitreous gel and blood from the back of your eye. This allows light rays to focus properly on the retina. Scar tissue might be removed from the retinal surface so that the retina can be returned to its normal location. Laser treatment also may be used to prevent abnormal blood vessels from growing on the retina. After the surgery, a member of the operating team will cover your eye with an eye dressing and an eye shield, which will be removed by staff prior to your follow-up appointment. You will be taken to our post-op recovery area for further care. Some vitrectomy patients will stay overnight in our ophthalmology assessment unit, and some will go home the day after their surgery and be given a follow-up appointment for the next morning. As you are given sedation during surgery, it's important to know your reactions and judgments may be impaired. It can take up to 24 hours to fully recover. At your follow-up appointment, your eye doctor will let you know how long you need to wear your eye patch at bedtime. It is very important to follow your surgeon's instructions about body positioning during the recovery period. For example, you may be asked to lie face down so the gas bubble inserted in your eye will rise to apply pressure to the retina and promote healing. Please feel free to ask your surgeon any other questions you may have at follow-up appointments. There is occasionally mild discomfort the day of surgery. It's okay to take 2 regular or extra strength acetaminophen as required. Do not take aspirin or aspirin-based products unless you check with your eye surgeon. If you become constipated, take a mild laxative. Straining while having a bowel movement can injure your eye. You may have blurry vision and the feeling that something is in your eye after surgery. This is normal. It's important you do not touch or rub your eye with your fingers. Improvement in vision varies from person to person. It may take up to 3 months. You may experience double vision, which is normal and will usually disappear. You may be quite light sensitive, especially in the first few weeks. Wear sunglasses or clip-ons to help. You may have tears in your surgical eye. Simply wipe your eye using a clean tissue. Avoid dusty environments where dust or dirt is blowing or other possible eye irritants such as smoke or strong fumes. In terms of activities, you can resume most of your usual daily activities such as reading and watching TV as the comfort of your eye permits. If specific positioning is instructed by your surgeon, the positioning should be maintained for 45 minutes of every hour during the day and night unless otherwise instructed. You may go for short walks. You may go for short drives as a passenger. Your surgeon will let you know when you can resume driving. Do not lift anything over 10 pounds or do any physical activity until advised by your surgeon. For example, shoveling, yard work, or playing sports, and especially not swimming. Avoid getting water or soap in your eye for 10 days after your operation. Gently wash around the eye with a clean washcloth and warm water. You may shower, but do not face the shower head. You should also apply cold face cloths to the eye for 15 to 20 minutes 4 times a day. Do not wear eye makeup for 2 weeks after surgery. Don't worry if this seems like a lot of information. You will be given a handout after your surgery, and all of this information can be found on our website. After surgery, it's very important to call your eye surgeon if you have severe eye pain not relieved by acetaminophen. Notice a sudden deterioration in vision, have increasing redness or swelling of the eye, notice any yellow or green discharge from your eye. If you experience any post-operative problems and are unable to reach your eye surgeon, please return to the Misericordia Health Center. Misericordia is open 24 hours, 7 days a week for emergency eye care. Go straight to patient registration on the first floor. If you live outside Winnipeg, please visit the nearest healthcare center. And that's everything you need to know about your vitrectomy surgery. Please feel free to add comments to help improve your experience at the Misericordia Health Center.